Hello. Before we begin, we wanted to cover a few housekeeping items. At the bottom of your screen are multiple application widgets you can use to interact with the webcast. You can submit questions to our presenters by using the Q&A widget, or interact with other attendees by typing in the group chat widget. If the slide deck has been made available for download, it can be accessed in the Available Resources widget on the bottom right-hand side of your screen. If you are interested in continuing education credits, please click on the Sign Up widget in order to specify your credit type. In order to qualify for CPE credits, you must stay logged in for the full hour and click on interactive prompts which populate 3 times throughout the webcast. A recording of this webcast will be made available 24 hours after the live session and will be emailed to all registrants. You can share this webcast with a colleague or friend by clicking on the light blue share icon. Finally, we appreciate your help in improving our webcasts. An evaluation form will appear at the conclusion of this webcast, and your feedback allows us to continually make better content for you. Thank you from all of us at the Conference Board.
Good day, everyone. I'm Greg Morrow, Program Director with the Conference Board, and I'd like to welcome you to today's program, What Engaging Medical Staff Can Teach You About Your Own Employees. Some of the critical questions and issues we'll be answering today include what outcomes to expect from virtual expert medical opinions, how combining meaningful incentives and thoughtful employee engagement leads to increased savings, high employee usage, and satisfaction, how to yield higher total program utilization and savings with thoughtful plan design decisions, and how to use informed guidance to empower members to make better decisions during pivotal moments of their healthcare journey. If you're interested in earning continuing education credits, as Luke said, simply stay online for the entire webinar. You'll see 3 pop-ups. Just click OK for each. Credit is available for live attendees only. And for Q&A, we'll be taking those at the conclusion of the presentation. Just submit your question using the Q&A widget at the bottom of your screen. And now it's my pleasure to introduce Jodie Pierce. She's National Account Executive with 2nd.MD. With nearly 20 years of experience in the healthcare industry, Jody's worked to improve the health of employees, students, and the community through public health policies and programs. She's worked for a health plan and with numerous health plans during her career, driving member engagement in health and well-being benefit solutions. Jody, welcome.
Thank you so much for the introduction, Greg. I am honored to be moderating this session this afternoon and have the pleasure to introduce our panelists to you. The first up is Monica Williams. Monica is Baylor College of Medicine's Executive Director. She oversees the Health and Welfare, HRIS, and Communications team for Human Resources Benefits Department at Baylor College of Medicine. Monica has been with Baylor College of Medicine for 15 years. The next panelist is Courtney Richardson. Courtney is the Senior Communications Associate Director at Baylor College of Medicine. Courtney organizes the strategic senior level communications for human resources at Baylor. And the final panelist this afternoon is Morgan McHugh. Morgan is the Vice President of Client Success and Growth Operations at 2nd.MD. She partners with client management and our sales team and our employer customers to connect individuals to life-saving or health-improving consults when they need it every day. We are happy to have everyone here with us today and are really excited to share the latest insights on how second opinion solutions are not only a tool for clinical expertise, but also lead to high employee usage and high employee satisfaction with their benefits. So we have Monica and Courtney with Baylor College of Medicine with us today. Baylor College of Medicine partnered with 2nd.MD to really use communication programs and proactive outreach through predictive analytics to really drive overall benefit utilization. So not only did Baylor improve the health of their employees and their family members, they also raised satisfaction by implementing 2nd.MD's virtual expert medical opinions. This is a really valuable lesson for employers. So I'm going to start with Morgan and kind of jump into some questions for our panelists. Morgan, can you tell us who you work for and what you do, and really explain expert medical opinion services to employers that are on the call today who maybe aren't as familiar with this benefit solution?
Absolutely. Thank you, Jody. And thank you to everybody who's attending today. And a huge thank you to Baylor for participating with us in this webinar today. As Jody said, my name is Morgan McHugh. I'm the Vice President of Client Management at 2nd.MD. So I have the pleasure of working with some of our largest customers on utilizing the 2nd.MD benefit. I like to call myself a 2nd.MD evangelist because I believe so heavily in what we do. I've used the service personally. I've used it for family members. I really don't let anybody in my family do anything until they speak to one of our specialists because I believe so heavily in what we do. One of the best ways to just describe 2nd.MD at its core is that our mission is to connect people that are battling pain and disease with some of the very best specialists in the country to get authoritative advice on what their next steps in care should be. And the way that we do that, I think, is what is so powerful. Expert medical opinion services have been around in the marketplace for decades. They're often written services where a doctor will actually write out an opinion, and that's delivered in a written form to a member, or members are sent to local specialists. What 2nd.MD does that's so different is that we've assembled a incredibly elite panel, and we're going to talk a little bit about how we do that, to have live two-way conversations with members so that they can really gain that trust that they need to with those specialists. They can ask the questions directly of those specialists, have those specialists ask questions of them, and get authoritative advice on what their next steps in treatment should be. When you do that, some really powerful things happen. You improve clinical outcomes, and you also save money as an employer by stamping out a lot of unnecessary care. Kind of in preparation for this webinar, we actually polled some of our nurses to just get a feel of some of the questions that have come through just in the past few weeks into our team. And these are the kinds of things that people are dealing with. So I'm going to read some of these verbatim. Do I need to get an aortic valve replacement surgery now, or can I wait a few years? I'm at high risk for stroke. If I don't follow the treatment plan that was recommended by my doctor, what will happen? Do I have any other options rather than the knee amputation that my physician suggested? These are really heavy, scary questions that people are dealing with. And one of the things that 2nd.MD does is they connect them for that live conversation with one of the very best experts in the country to get advice on what they should do next. And through that interaction, we actually see about 98% adherence to those recommendations because of the trust that's garnered. That's a little bit about 2nd.MD. Jody, I hope that kind of answered the question well.
That did. Thank you so much, Morgan. I want to transition to a question to Monica. Monica, why are second opinions important? And what are Baylor College of Medicine's, ambitions, goal, desired outcomes with this benefit solution through 2nd.MD?
Sure. Hi, Jody. I want to also thank you all for the opportunity and want to welcome everyone who's attending the session with us today. Second opinions for Baylor are important because it's beneficial to our individuals in our work population to determine which treatment option is appropriate for their situation. We have over 10,000 employees and their family members within Baylor College of Medicine, and we're also a large healthcare provider with quite a diversity of people and jobs. We needed an expert medical opinion service to help guide and high impact and high risk employees to a vendor that would help them gain medical certainty and peace of mind, while at the same time having the ability to influence major cost drivers while still improving outcomes. Because I know most of the employers that might be on the call today may have the same goals, we were seeking avenues to try and curb and reduce our spending within both our medical and prescription drug plans. We wanted to make improvements to the benefits that we currently offer, and we also wanted to promote engagement and the need for our employees to take control of their health and well-being.
Thank you, Monica. Another kind of follow-up question. What business problem were you trying to solve, and why were you looking for help around second opinion services or expert medical opinion consults?
Right. Like I said before, we were looking for solutions to, reinforce that savings and improve our outcomes. We were looking at abilities to try to decrease those cost trends, because medical and prescription cost trends are extremely high. And so we needed a comprehensive tool that would look across all conditions. And we were also evaluating at the time what was our driving costs, what was our risk, and the mitigating those risks. We wanted to once again actively engage those high risk and high impact employees for that second opinion service. And we wanted to do that prior to the procedure to manage the risk. And we also wanted to create a world-class member experience, which could also produce loyalty between 2nd.MD, Baylor, and our work population. We wanted to also implement a solution that would apply to all specialties, all subspecialties for adult and for both pediatric, medical, and behavioral. And we were also wanting to find a service that would cover all that, but we wanted a service that was easy to implement. We needed to determine what was the best product available to produce those desired incomes, and our medical plan carrier actually suggested that we review 2nd.MD.
Great, thank you. I'm thrilled that 2nd.MD was able to be that vendor solution and really partner with Baylor College of Medicine. It's just been a phenomenal partnership with your team. So another question for you, how are virtual expert medical opinions even better than traditional second opinions? And really, what makes 2nd.MD stand out to you, Monica?
Well, as I stated earlier, taking control of our own health and well-being is extremely important. And we just need to realize that there's more than one right treatment available. And for me, this is how the virtual expert opinions can be better than traditional, whereas traditional may take a longer length of time to even get in contact with a second opinion provider. And so what stood out to us for 2nd.MD is first, it's that our medical carrier recommended the product to us. So that was a plus for sure. Second, upon further discussion, and one of the most exciting findings that we found, that we had Baylor College of Medicine specialists that were actually a part of 2nd.MD's virtual expert panel, which was also another plus for us. Next, we found we could get employees and family members in front of those key specialists that they need within days versus weeks and months in some of the traditional settings. So, all the pluses just kept adding up for us. And also 2nd.MD, we realized they revolutionized the second opinion service in the US and were the first to bring the virtual second opinion options to the market about 10 years ago. And lastly, the specialists that are offered through 2nd.MD, they speak with the member more than on one occasion. You don't have to continually start over and explain your situation each time you call in. And 2nd.MD they saw improvement in almost 82% of their cases. So all of that in a nutshell basically is what stood out for us with 2nd.MD.
Thank you, Monica. That's very helpful, very insightful. Can you just talk a little bit more about the 2nd.MD, how 2nd.MD technology made it easy to have your other vendor partners work together, and then also address how the implementation of 2nd.MD went? I mean, that might be a question that some of the employers on the line are thinking about.
Right. Well, 2nd.MD made our implementation very smooth and very easy. for all of our staff and vendor partners. We needed that second opinion solution to guide our high impact and high risk members, but we didn't want it limited to just certain procedure codes, which is not the case when we researched and met with Second MD as a partner. They made it easy to integrate with our other vendors. It was important for us to meet with the multiple partners together at the table when we began implementation to provide a great connectivity and working relationship to build all of that from the start. And Second MD worked with us to create a great consumer experience to connect all of our different vendor partners together and really work collaboratively with them to provide the peace of mind for our employees.
Great, thank you. I know that's definitely at the mission of Second MD to really provide that collaboration with obviously Baylor College of Medicine, but also your existing vendor partners, and to make sure that we're working really well together. So I'm going to transition over to Courtney. It's time to hear from Courtney. At Second MD, we provide communication awareness campaigns to really drive activation and engagement through a variety of marketing communication tactics, such as email awareness campaigns, direct mail, and a variety of other tools. How has this program engaged employees who maybe wouldn't have participated otherwise?
Hi, thank you, Jody. First, again, I want to welcome everyone, and thank you so much for joining today's session with us. But just to tap in a little bit as to how the collateral pieces that were provided to us by the Second MD program have been beneficial in not just engaging employees who were already involved, but also those who may not have been engaged, was the fact that Second MD provided such a various amount of collateral pieces and actually helped us to tap into our internal communications. As Monica mentioned, we have such a diverse and unique population. We definitely try to communicate as many types of ways that we can. And so Second MD was very helpful in providing us with numerous communication collaterals to get all employees engaged. Monica can attest, the first piece of communication pieces that were sent to us, we were like, I love them. Second MD definitely provided us with activation emails, different things that we can post to our intranet, email platforms, and just everything that we could use to help all employees get engaged. So definitely offering us the different collateral pieces that could be provided across all avenues that we use to communicate has been beneficial in engaging all of our employees.
Wonderful, thank you. As Second MD always collaborates with our employer partners, we want to develop that overall engagement strategy and really customize it. We know it's not a one size fits all. And so that's definitely the approach that Courtney mentioned that we took with Baylor and had really great success. So another question for Monica. It's been mentioned a couple times about Baylor College of Medicine's unique population. So I'd like to dive into that a little further. Monica, can you talk really about what makes Baylor College of Medicine employees and just your culture unique?
Sure. We have many types of employees that work at Baylor College of Medicine. We have, regular staff employees, we have medical residents, we have students, we have both research and clinical postdocs, we have faculty who actually teach as well as see patients in our clinics and our other affiliate hospitals. And we have well over 200 countries that are represented as a part of that Baylor culture. So we see it as a uniqueness because we have so many different levels of and types of employees. And we think that's what makes us unique in how we operate as a team. We're very intentional in how we communicate. Our people are very vigilant and they're smart in maintaining their security. So when we decided to implement Second MD, we coordinated closely with you all to ensure that our employees knew that the communication they were receiving was authorized from our team, and so that we could fully have employees engaged in utilizing the benefit. Because if they receive some type of mailing an email, a phone call, or anything of that matter, and it has not had the stamp of approval from HR or the benefits team, we will hear about it.
Yes, we will.
Thank you, Monica. That's really helpful to hear more about that and just how, why branding together makes sense and how we need to, be included and really think about that with our overall engagement strategy.
Right.
So thank you. Another question for you, Courtney. What value adds does 2nd.MD provide to help with your communications internally?
Sure. So as you mentioned, just allowing us to have that customizable communications collateral and being able to use that across the many different avenues and channels that we use to communicate has been very beneficial in communicating to our employees. As Monica mentioned, we have very sophisticated and smart employees. And so if they receive a mailer or if they're looking at the intranet, they want to make sure that that information is accurate. And so 2nd.MD has been very beneficial in providing such unique and customizable communications to spread across those different avenues that we provide to employees with communications. We have well over 10,000 employees, and so the population is unique and diverse, but we also understand that employees like to receive communications in different forms and styles, right? And so we've recently implemented a new software system that helps us to track and monitor how those communications are received, as well as surveying our employees to understand the types of ways that they like to receive communications and the best way to communicate to them. So 2nd.MD providing us with many different collaterals and customizing them and being able to tap into our internal communications definitely helps us to provide employees with the best types of information to utilize the service. We've seen that employees are constantly providing us with feedback during our surveys. And so that definitely helps with completion rate well over 90%, as well as tapping into 2nd.MD. So it's been very beneficial from you all providing us with the customized collateral pieces to help communicate to the employees.
Great, thank you, Courtney. And one thing that she mentioned, that the member surveys, and so we get members are invited after they have an expert medical opinion with 2nd.MD to complete an overall satisfaction survey, be able to provide more feedback on their experience, as well as leave some member quotes. And so that's something that 2nd.MD on a regular basis is providing to the Baylor College of Medicine team. And so obviously Courtney and Monica can use some of those great quotes in some of their internal communications. And so we've talked about Baylor's approach to overall engagement, and I want to throw a question over to Monica to just talk more about our engagement strategies at 2nd.MD, what things you've seen that really work to drive that overall utilization and cost savings.
Sure, I can.
I'm sorry. Go ahead, Morgan.
I can take that. Yeah, we have a lot of employers that will deploy different types of strategies. I think Baylor's done an amazing job outlining kind of communication collateral that we provide. And I'll kind of harken back to that comment that you can't really use a one-size-fits-all approach when it comes to communication. You really have to understand your population, weave comms into the existing channels, what works well for that population. But we also use a very data-driven approach at 2nd.MD as well, and deploy proactive outreach as well, where we will receive data and then run that through a proprietary algorithm to identify members who may be on a path to a second opinion. And we proactively outreach to those individuals. I know these types of proactive outreach programs have been around for a while. And I will be honest, when we first launched ours, I asked myself, is this really going to work? Are people going to pick up an unknown number and actually take the call and be willing to trust that we are who we say we are? But what we found is that what we are offering is so compelling to individuals who are really struggling. And I think that's really the thing to keep top of mind, is that we're talking about people that are making some really major medical decisions. And when you have the sponsorship of the employer, when you have those communications going out, people are really grateful a lot of times for that phone call that reminds them of the benefit when their head may be spinning, or they may be in a place where they're just not able to think about all that they have access to. So that's one of the programs that we have. We also have clients who will require the use of 2nd.MD for within their plan design for particular high impact procedures. We have others that offer gift card incentives for the use of 2nd.MD for high impact procedures. And we find that those strategies make a world of difference. They really drive people to the benefit that might otherwise be a little skeptical. And we see it as our job to make sure that they have a fabulous experience, and that bears out in the data. Even customers that have penalties in place where you have to use 2nd.MD or you're assessed a deductible penalty, we still see NPS scores well over 85 for those customers, which is a world-class NPS score. So there's a lot of different ways, and we like to use kind of a multi-level approach to engaging a population.
Great, thank you, Morgan. And I have another question for Monica. Can you tell us about your employees' experience when they call in for a virtual expert medical opinion?
Sure. I can start off first with my own experience because I did have an experience where I had to reach out to 2nd.MD on my own. And even though it's virtual, you still get that human touch feel. It was a great experience. And for me, it was the peace of mind and the clarity that I received during that time of uncertainty, when you receive a diagnosis or you receive information from your doctor stating that you need some type of surgery. And like I said, I myself reached out to 2nd.MD for that second opinion. And the nurse that was assigned to me, as I said, that peace of mind and that clarity, it was the kindness and the most calming spirit about her that she allowed me to take that time. She took that time to listen to my situation. She recommended the course of treatment, and she followed up with suggestions later that evening and also that next morning. And you never could get that type of quick response using a traditional second opinion option, because it sometimes takes you, as we said previously, weeks before you can get in to see another physician for a second opinion. And for me, just having that as an option, to know that it's there. So whenever I receive some type of diagnosis or I receive some type of issue from the doctor saying that I have to have surgery, I know that I have a comfort level that I can call and speak to someone at 2nd.MD, and I feel I'm guided in the right direction. And I'm not the only one that has had great experiences. We have had another employee that has provided us with feedback on a situation. She had a very complex issue, and she had a variety of treatment options. And she wanted to gain some kind of medical certainty over her life. And as I said, get that peace of mind that we always want when we're facing some type of illness from our physician. And so what ended up happening with this individual, her feedback was the nurse that she spoke with, or the physician she spoke with, the last name was Myers. She said she was amazing, so compassionate, smart, and really on top of her case. She had such a good understanding of her condition, her concerns, and her questions. And she was incredibly thoughtful in pairing her with a specialist. She stated Ms. Myers had gone truly above and beyond for her in terms of helping her get all the answers she needed. She had never felt so cared for and empowered and important in a medical context before. So for her, it was just an amazing experience. it avoided her paying over $141,000 in cost for a surgery that wasn't necessary. So those are the types of things that our employees experience through 2nd.MD, and that's the type of experience that we were hoping would come out of our partnership with them. And that is one of the most important benefits through 2nd.MD. It just, many times when people come to HR, 9 times out of 10 it's complaints, it's bad news. So it's nice when we can actually have some positive feedback for a service that we're providing to our employees, and they're also getting great experiences. So they're appreciating the benefit. And that's, within the scores that we're seeing and the benchmarks that we're seeing and the data that we're receiving back from 2nd.MD, that it really shows that our employees are engaged and they really are appreciative of the service.
Thank you, Monica, for sharing your personal story and that member story, and so happy that 2nd.MD was there for you when you needed our services and really be able to provide that care and give you, as you mentioned, that medical certainty, that confidence moving forward in your treatment plan, and obviously your employees that are also using our service. And you mentioned that, Net Promoter Score, that is something that 2nd.MD is really proud of. Our NPS score is a 91 across our, that's our benchmark across our book. So that's really, really excellent. And Baylor College of Medicine is even higher than that. So as Monica mentioned, really high satisfaction, which is great. So Morgan, I want to transition over to you in really talking about what sets 2nd.MD's nursing and clinical care team staff apart. How do they really make that human touch the backbone of everything they do, especially knowing a lot of this is, or all of this is done virtually? And how are the nurses organized to really bring out their specialty and pair that with the members' needs?
Absolutely. Thank you, Jody. So 2nd.MD has been very intentional in doubling down on what we call a nurse-led model. So we have an amazing specialist panel, which I think we're going to talk about in just a second, that's actually providing the recommendations. But we really see our nurses as the quarterback of the experience. And nurses just in general, I think by nature, are phenomenal humans. They're trained to be great navigators and very compassionate. And we see the nurses as the kind of the most important linchpin in navigating a member through the process. One of the things that we are also very intentional about is the specialty set of the nurses. So at 2nd.MD, we are all about kind of specialty care and making sure that we're pairing members with what we would call the Uber It from a specialist perspective. We try to do that on the nursing side as well. So we use something called skills-based routing, and we pair individuals that are coming to us with specific issues with nurses that are disciplined in that space. So for example, if you were to call in with an oncology question, you would go to our oncology team. Our oncology team is comprised of nurses, most of whom have over 20 years of experience coming from major cancer centers like MD Anderson. If you called in with an orthopedic issue, you would go to the nurses that have deep experience in the musculoskeletal space. And that's really important because they know the right types of questions to ask. They know the right types of records that need to be obtained. And that's kind of the second step in the process. We collect all of the medical records at 2nd.MD, and we do this incredibly fast. It is one of our differentiators in the marketplace as well. We have records teams that are collecting records on average in about 2 to 3 days, which is almost unheard of in the space. It's probably the question during actual sales presentations where we get the most eyebrows raised, and they really want to dig into that. But we have set up our operations and also have technology that support the kind of expedition of records. And so our record specialists are also very tailored to specific conditions as well. They know the types of records to get. They know if they've gotten the right records. And we want to take all of the legwork off of a member and make sure that we're removing as much of the red tape as possible so that we can get them to the most important moment, which is actually that conversation with the specialist.
Great. Thank you, Morgan. I love that analogy to the nurses being the quarterback. They definitely serve in that role and just do a phenomenal job in taking care of our members that are coming to 2nd.MD every day. Morgan, another question about the specialist. How do you ensure the specialists also embody the 2nd.MD culture, the 2nd.MD spirit in the care that they're providing?
Great question. So we have an entire team that does nothing but assess our specialist panel and onboard elite physicians onto that panel. We have a variety of criteria that we look at when we are assessing if someone meets the credentials to be on our panel. We look at things like where were they trained academically, where did they do their residency, how many peer-reviewed research pieces have they authored, where are they currently practicing. We even look at things like bedside manner, consumer reports, any medical malpractice suits. We're really doing an incredibly thorough vetting on the specialists. And when we're matching members to those specialists, we aren't just looking at what their general discipline is. We are looking at where they spend most of their time. So for example, if you come to us for a very specific issue around your knee, we're not just going to compare you with a top orthopedic specialist to have that consultation. We're going to connect you with a top orthopedic specialist that does pretty much nothing but focus on knees and your very specific issue. And that's one of the reasons why we are able to drive over 82% improvement in treatment plans, about 33% in caught misdiagnoses, and about 30% in surgical avoidance, is because we are pairing individuals with specialists that are so disciplined and so elite in their space that they have access to kind of real-time medical advancements that they can offer to our members. And individuals get about 30 minutes with those specialists. So if you all just kind of close your eyes and think about the last time you went to a doctor, how much time did you actually spend in that exam room with the physician? It was probably less than 5 minutes. And so our specialists love being a part of our panel because they feel like they get to be doctors again. They get to sit down with patients and speak to them in depth for about a period of 30 minutes. And that's an incredible amount of time to get with any physician these days, and particularly the types of physicians that it would take you a very long time to access on your own locally.
That's great. Thank you, Morgan. That's one of the things that I see frequently when I'm reviewing those survey results with employers that I work. I see members talking about how the specialists really took the time to provide that education about their diagnosis, to review their prescriptions, their medicines that they're on. They felt like they got all their questions answered during that really robust, comprehensive conversation. As Maureen was mentioning, it's very common that they're 30 minutes or much longer for those complex consultations. And so, they're not rushing next door to go see the next patient. They really have that undivided attention. And I think that's sometimes surprising for our members when they have that experience and just how incredibly satisfied they are with the information that they gathered from that specialist, how they were able to get all their questions answered and really feel confident in next steps and moving forward with their overall treatment plan. So that's really fantastic. Monica, I have a question for you, a very important one. So how did virtual expert medical opinion lead to better healthcare outcomes and lower cost?
Sure. We, over every year we have mid and annual reviews with our medical carrier. And, we always look at those particular categories that are high dollar claims, where our employees may be spending the most dollars. And most times cancer is our number one, um, one of our number one categories. And we also have musculoskeletal, because what we found in times past is that when any type of musculoskeletal injury or illness, that sometimes the first route is for surgery. And as we said in the beginning, we wanted employees to understand and their family members to understand that there's other treatments available for them. Hence the reason 2nd.MD is a part of our platform now. But just using the musculoskeletal as an example, just year to date for 2021, we identified at least 339 members that qualified under this proactive outreach program that was put into place. And of those members, we were able to actually touch 27% of those qualified members. They enrolled. 25% of the members were actively engaged, which is extremely well, considering the fact that if I've been told that I'm going to have surgery, I just go and schedule my surgery, and I have no, I don't think of seeking a second opinion or looking for other options out there. This is what my provider has told me, so I think I need to just go ahead and stick to and have the surgery. Well, but using the 2nd.MD, it does allow for that second opinion option to be available. So using that same type of idea, we also looked at some of the data points that we had over the program thus far on our expert medical opinions, our personalized local support, and our specialty care navigations. And to date, we have saved over almost $265,000 in total cost savings, just utilizing, having employees to engage and their family members to engage in the utilization of 2nd.MD. Getting that second opinion saves money. It really is a beneficial benefit to our employees. We've had over 18 consults with the expert medical opinions, and those also have saved us almost $14,000 a year. And we have the one consult that this individual saved and kept in her pocket over $141,000, as well as those costs that would have extended out into our medical plan cost. So, just the 60%, we've had like a 60% surgical avoidance. So we've had employees or their family members that have reached out to 2nd.MD because they have had a recommendation to have surgery. But when all the points are brought together, the second opinion specialist is involved. They look over what has been provided to the member, what has been provided by the provider, and all that comes in together into one full picture. Then that's where we've had the 60% surgical avoidance. There have been other options that the member or their family member have had in order to resolve their issue, other than basically, for lack of a better word, going under the knife. We have had a lot of improved treatment plans. Like I said, I myself, with my diagnosis and my information from my provider, it gave me a moment to think, is this the right treatment plan for me? And after speaking with 2nd.MD and the specialist that I was provided with, I realized that that wasn't my only option, and this option is a better route to go. And in actuality, it saved me a lot of out-of-pocket expense. Taking that step to reach out to 2nd.MD to find out what options I had out there. As far as alternate diagnosis that have been proposed, we've had like a 53% rate on that. And that, once again, shows how giving and offering this option to employees is so beneficial to them. We we've had feedback, just a lot of positive feedback from employees. One employee in particular had reached out to me and given me an email like, where has this been all of my life? They were thankful to Baylor for implementing this type of program. They wished it had been around long before we implemented it. And with the success that we're having so far, in my mind, I really wish it would have been around back then as well, because we probably could have helped way more employees with different categories of programs based on what we see now. So it has just been a very positive experience for us in the HR benefits office, as well as for the Baylor population.
Thank you so much, Monica. It's fantastic to hear not only about obviously the high satisfaction, but the cost savings that you're seeing already this early on. You know, keep in mind, Baylor College of Medicine just launched on January 1st. And then also those clinical outcomes are very significant that they're seeing, you know, just not even 9 full months into having second MD. So really excited to continue to see really fantastic outcomes over time. So thank you so much. And at this time, we're really going to take a moment and we're going to transition to Q&A. So we have a few questions that have already come in, and would just encourage you to continue to submit any questions that you have for any of our panelists.
Thanks, Jody. Thanks all for submitting questions. We have a bunch. First is, how do you build trust with the person with just one call when the person has had their provider for maybe decades?
That is a really good question. So I will say that in regards to kind of one call, it's one moment with the specialist. However, the nurse experience that I talked about can be a multitude of interactions, and typically is. So we start building trust at the beginning with that nurse intake call and build a rapport. As part of our process, our nurses are really trained to make sure that individuals are aware of kind of what the service is for in terms of getting that extra set of eyes. And it's not to necessarily challenge your doctor or create some kind of adversarial relationship with your local physician. It's really important to us that the local physician can be a part of this process. And we often find that they enjoy being a part of this process because the nature of the specialists are so elite that they themselves enjoy collaborating with specialists that are sitting in these major academic institutions. One of the best ways that I think that we build trust with members is that we send them a full bio of the doctor that they'll be speaking with. And these are pretty comprehensive. It even includes a picture. You can see all of the awards that they've received, all the publications they've been a part of, where they trained, where they are currently working. And when you read those bios, you really get a sense of, wow, I am truly speaking with someone who is best in class at the top of their field. And that helps build trust along the way. But it's definitely a process, and it's more than just that one conversation. After the consult is complete, the nurse follows up again, makes sure that all the questions are answered in the consult, and then helps a member with their next steps in care so that they can actually execute that plan locally. So when I've referred to the nurse as the quarterback, that's really what they're doing. They're shepherding someone through that experience.
And Jody, if I can tag on to Morgan,
Sure.
You know, once again, I have to utilize my own experience because that's the best kind of response. For me, I did include my provider into the conversation. So the information that I did receive from the nurse at the time that I reached out to Second MD, that information was provided to me via email or whatever channels that I had. And I did share that with my provider, and my provider and the Second MD specialist did have communication. So there is a way to bridge that gap between your provider that you've had for decades and what you're going through, because some people may not want to discuss, but I don't want to alienate my provider that I've had for 10 years by going to another provider. But it sometimes it doesn't really work out that way. They actually collaborate more to make your care, to make sure they have 100% full circle care for you.
Monica, there's a question kind of a little bit related to that, to your experience, which you just mentioned. Question is, does the specialist and the doctor that is the patient's usual doctor ever collaborate?
Yes, and I can 100% tell you that they do. You know, like I said, my situation, I went to second MD because I just wasn't quite 100% sure that this is the route I should take. And I actually told my provider that we were offering this benefit and I wanted to utilize it. And she was 100% okay with that. And once I reached out to them, received that information, they collaborated together to get the best fit for me. And so, yes, they do collaborate. If you're willing to provide that information to them, they will collaborate with your provider.
Monica, I'll piggyback on that a little bit. The collaboration is really present in oncology cases in particular, particularly if you have a rare form of cancer. One of the things that we can really help individuals with is ensuring that the staging of their cancer is correct. We can review pathology, for example, and then have an expert weigh in without having somebody actually travel to an MD Anderson or travel to a Memorial Sloan Kettering to get that second opinion. And then they can execute that care locally, which is really important for people who are undergoing ongoing treatment. On the reverse side, though, there are some cancers where you need to be at an NCI designated cancer center because of the complexity, and our oncology nurses can also weigh in on that as well. And all of that is usually coordinated with the existing local or general oncologist that the patient is seeing.
Thanks, Morgan. We have a question from Monica. I think you might have alluded to this in your personal experience, but the question here is, by implementing the solution through your health plan, did it make the process and implementation more difficult or less difficult?
I can say this was one of the smoothest implementations I think I've encountered in my 15 years with Baylor College of Medicine. Second MD, and Courtney can chime in on this as well. From start to finish, all the implementation process everything was timelined out for us. The time period that it took to do one step to the next step to the next step, they provided us with all the materials that we would need, all the communications that we would need. It's like Courtney said in her question earlier, we were excited when we saw that welcome kit, because the design and the clarity of it was just so great. And we just didn't feel that we would have any issues with the implementation. So for me, it was extremely smooth.
Yes, and I can definitely co-sign Monica in the implementation process just being smooth. The communication pieces were so simple and so easy to understand, regardless of what level your knowledge base is on, whether you understood your diagnosis or you didn't understand your diagnosis. Second MD provided such unique and customizable pieces that made the implementation smooth and communicating to employees, as well as on our end, just implementing the benefit in itself. So I can definitely agree, one of the smoothest and easiest benefit programs that we've implemented. And I've not been with Baylor College of Medicine as long as Monica. I've been with Baylor 7, almost 8 years, but definitely can attest that it was very smooth and easy to communicate to our employees as we continue to communicate post-pandemic, and with things changing and the workforce and the dynamics of in-person to virtual options. Second MD has definitely been one of the easiest programs to implement for sure.
Courtney, while we have you there, question for you. Are you able to share what's garnered the highest engagement with your communications pieces and channels?
Absolutely. So I can give a little testimonial myself. Actually, before the pandemic, both Monica and I are big fans of participating in conference board conferences. And so we actually had a communications conference before the pandemic that talked about different strategies and engaging employees and how the virtual options would be more available. And so when we implemented Second MD, we knew that virtual would capture employees' attention. And so honestly, us being able to use all of our various avenues to communicate this program has been what's garnered engagement. Our unique and diverse population being spread across not just the Texas Medical Center, but across the world at this time. They've been able to access the communication pieces that were mailed to them, that are posted online, that are emailed, as well as the different virtual options that are provided once they actually participate in the program. So just having that unique, diverse access to communication pieces and collaterals has been what has helped us in engaging our employees. It's not just a one-stop shop at all. Employees can tap into what needs they see best fit just based on the different pieces that are available to them. So we've definitely implemented more virtual opportunities just based on our implementation of Second MD. And as we go into planning for open enrollment and next year's benefit programs, we definitely kind of look to what Second MD has provided and offered to us as a model to communicate to employees across the board with all of our other benefit programs. So just being able to have such a unique and customizable communications collaterals to offer across all of our channels has been what helps engage employees the most.
Thanks, Courtney. Thank you. Question for Jody and Morgan. Can you talk a little bit more about cost breakdown?
Sure, I can just very briefly kind of talk about pricing options. So we do offer PEPM pricing and also case rate pricing in the marketplace, which again, I think is a little unique to us that we offer that case rate pricing. We offer that on a direct to employer basis, but like Baylor, a lot of our clients contract through their health plans. Baylor is a client of ours through United Healthcare and Optum, who we have a wonderful partnership with. They help us drive meaningful outcomes using a lot of their predictive data as well. So that's an option. We also have a great partnership with Aetna. So you're able to contract through Aetna as well as some of the Blues plans like Blue Cross Blue Shield of Michigan. But if those are questions you want to kind of dive into deeper, we're happy to take your information and schedule a call to more succinctly talk about pricing options.
All righty. Thanks, Morgan. Jody, that's all the time we have for questions for now, but could you talk a little bit about the white paper?
Yes. So we have a wonderful resource available on a white paper, and it's titled Using Data to Drive Virtual Expert Medical Opinion Utilization. So it is available on the resources widget. So you can either click there and download that particular white paper, or you can go to our Second MD, and there's a link right there, our Second MD /lower cost. I encourage you to take some time to review that. I think you'll find it very valuable.
Thanks, Jody. Before we wrap up, just want to tell everyone about a couple of things the Conference Board has going on. Our 27th Annual Executive Compensation Conference is virtual. Next week on September 28th, complimentary for all Conference Board member companies. Upcoming webcasts, we have how to improve claim savings with end-to-end transparency next week on the 28th. How to strategically measure program impact through data trends on the 29th. And inclusive leadership for building equitable organizations on October 7th. And of course, our 2021 annual Employee Healthcare Conference is happening live and in person in New York October 28th and 29th, and in San Diego on November 18th and 19th. Second MD is one of our lead sponsors for that event, so thank you very much for being a part. And my TCB, sign in to enjoy customized, convenient access to the full range of member benefits, the latest research, benchmarking, and data tools, peer networks, and events delivering trusted insights for what's ahead. And our C-Suite Perspectives, hosted by our CEO, Steve Onlen. This is a bi-monthly series featuring in-depth interviews with thought leaders from the conference board to provide senior leaders and C-Suite execs with data-driven insights to prepare for what's ahead. So with that, I'd like to thank everyone for participating. We really appreciate you being a part of the conference with us today. And Monica, Courtney, Morgan, Jody, thanks so much for being with us. We really appreciate your time and sharing your work. So with that, everyone, have a great rest of your day, and we'll see you next time.